What could happen to my baby if I use opioids during pregnancy?
There's a risk your baby could be born dependent on opioids, which can result in neonatal abstinence syndrome, or NAS. Babies with NAS experience withdrawal symptoms like problems with feeding, sleeping, crying, and seizures. Without proper treatment, NAS can have a serious impact on your baby's long-term health. Seizures from NAS are especially dangerous for babies and could lead to death if not treated quickly enough. It's extremely important for pregnant women taking opioids, whether they're prescribed or not, to engage in prenatal care and other treatment if needed, as quickly as possible once they know they are pregnant. Women who are trying to get pregnant should also seek out care as early as possible.
If I am pregnant, should I try to quit opioids on my own?
No, quitting cold turkey can be dangerous. Withdrawal during pregnancy is stressful for you and your baby and can lead to stillbirth and preterm labor. Instead, pregnant women who use opioids should seek medical advice to help them have the healthiest pregnancy possible.
What are the treatment options available for pregnant women taking opioids?
Treatment really depends on several factors and needs to be tailored to each individual. If opioids are being used for chronic pain, a pain specialist may be useful. If opioids are being used recreationally, for personal stressors, or to prevent withdrawal, then counseling and other rehabilitative services may be needed. One treatment option could include medication that's prescribed by a doctor. You might hear them called medications for opioid use disorder, MOUDs for short, medication-assisted treatment, or MATs, like methadone, buprenorphine, or Suboxone. During pregnancy especially, these medications are safer than opioids obtained without a prescription that can help reduce your cravings and withdrawal symptoms. Many people using opioids find that medications can help them get back to their lives. Doctors approve of these medications, and you won't face legal consequences for taking them. Some women also need medication for mental health issues like anxiety or depression, or for dependence on other substances like nicotine or alcohol.
What is MAiN?
MAiN is shorthand for Managing Abstinence in Newborns, which is a clinical treatment program developed over 20 years ago at Greenville Memorial Hospital for newborns at risk for opioid withdrawal after birth. The MAiN program offers support and consultation during pregnancy, direct care in the hospital after delivery, and home visits for breastfeeding and postpartum support after discharge. We will also talk with you about specific supports you might need and what additional resources we can connect you with. We can help you with things like scheduling appointments for you and your baby, infant care and safety supplies, and connecting you with community resources like diaper banks, transportation, housing, and job placement training. Overall, our goals are to help you have a positive birth experience, to improve care for moms and babies who have been exposed to opioids, prescribed or not, and to support you in the long run.
Does MAiN work?
Yes. We have served over 700 babies in South Carolina so far. The MAiN program can be found in the upstate at Greenville Memorial Hospital and at ANMed Women's and Children's Hospital. MAiN is also used in Oconee and Greer for prenatal and hospital care only. Babies born at a hospital with the MAiN program have shorter hospital stays and better health outcomes than babies who delivered at hospitals without the program.
If I enroll in MAiN, what happens when my baby and I go home from the hospital?
We continue to support you. We will help you stay connected with your community and keep your family healthy in whatever ways work best for you.
Sometimes women worry about how their healthcare provider might react if they say that they are using opioids. How does a MAiN provider react?
Our providers and nurses are committed to showing you empathy and having a non-judgmental approach to your care and treatment. We know that stigma around opioids and addiction can prevent people from recognizing a problem and seeking help. So we work hard to minimize and eliminate stigma in all that we do. We believe that every woman, no matter what they're going through, deserves a positive birthing experience. We're here to help.
Sometimes pregnant women taking opioids worry that their healthcare provider might call DSS. What does MAiN do?
The MAiN program is here to give you information and guidance without judgment. Certain situations might require MAiN staff to make a report to DSS, but this would be rare. I don't recall any cases of our staff making a DSS report. Most families enrolled in MAiN don't need DSS involvement, or a report to DSS was made before they joined MAiN. In any case, we are happy to advocate for you as best we can in these situations. We are also here to help you in the long term. For up to 5 years after your baby is born, you can call our nurse navigator. She can talk to you about any concerns about DSS that you may have, and she can identify what community resources can most meet your needs. That could include legal aid, housing, and more.
Dr. Hudson, what feedback do you hear from women who have completed MAiN?
What I hear from mothers who enroll in MAiN prenatally is this. They really appreciate having their questions answered in advance about what the hospital experience will be like. They're incredibly grateful for the physical resources we can help with, like a diaper bag and other infant care and soothing supplies that help with NAS symptoms. They also love having a consistent point person to contact for whatever they need.
Dr. Hudson, can you tell us why you are passionate about helping women who are taking opioids?
The reason I'm passionate about this topic is from personal experience. As a pediatrician, I've always advocated for the health of mothers and babies, but I never thought that addiction would affect my own family. My sister had opioid use disorder, but nobody knew. In 2023, she was dog sitting for me at my house when she overdosed on fentanyl. She was alone, so there was no opportunity for rescue. My sister's passing illustrated for me how opioid use disorder can devastate families. Her story makes it even more important for me to continue helping others with opioid use disorder.
What happens if I sign up for MAiN?
First, you will need to enroll in the program by phone or email. You can be referred to us by your OB or opioid treatment provider, or you can refer yourself by following instructions on our website, mainbabies.org, or social media pages. After referral, our team will review your information, and a MAiN navigator will contact you to talk about your next steps. Ideally, we'll connect as soon as possible to answer questions about how to prepare for delivery. We will see you in the hospital to give you a care kit and hands-on education that will help you manage any withdrawal your baby may have, and we will arrange any referrals and home visits that you think would be useful.
Can I still get help from MAiN if I have already delivered my baby?
Yes. Our special funding allows us to serve families who have an infant under 3 years of age who was born exposed to opioids. We can assist you with supplies and services that are tailored to your needs. In the past, we've been able to provide families with a car seat, feeding supplies, and breastfeeding support, clothing, vitamins, transportation, and referrals for other services. Even if you don't have custody of your baby, or if you are a kinship or foster caregiver for an opioid-exposed infant, we can help you.
How much does MAiN cost?
Most mothers and babies in the MAiN program qualify for Medicaid for all healthcare services from pregnancy through the first year of life. We also have special funding from counties in South Carolina to provide additional support and resources for moms and babies, like care kits, car seats, and home visits with a nurse navigator. Beyond normal medical care in the office and in the hospital, mothers and newborns enrolled in MAiN will not be charged for additional services.